Consider these facts. 1 in 4 adults in the United States experiences a mental health concern every single year. Mental illness causes more lost days of work than physical ailments such as arthritis, asthma, back pain, diabetes, hypertension, and even heart disease. And while emotional distress does not always mean a mental illness exists, it can still take a major toll on employee well-being, not to mention performance and productivity. In the end, everyone suffers when mental illness is left unaddressed in the workplace. Fortunately, organizations can take steps to create a supportive environment, or what is referred to by the American Psychological Association as a psychologically healthy workplace. Taking these basic steps not only helps employees in distress, it can increase employee resilience, engagement, and retention, as well as productivity. By building a psychologically healthy workplace, every organization can protect its most valuable asset, its employees. Just as organizations have begun paying more attention to the physical health of their employees, many are taking steps to maintain the mental health of their workforce as well. Positive mental health allows people to work more productively, reach their fullest potential, cope with the everyday stresses of life, and make meaningful contributions to their communities and their workplaces. In addition, workplaces that foster an attitude of support for employees who are struggling with mental health concerns can benefit in the following ways: reduced turnover, training, and recruitment costs, attracting talented people that appreciate a workplace that supports mental health, reduced sick leave, as employees are encouraged to address their mental health concerns before they become unmanageable, enhanced relationships in which employees feel supported by others at work, and improved productivity as engaged employees perform at their best when they know their employer cares. Mental illness is very common. In fact, 1 in 4 Americans experiences a mental health issue every single year. In addition, according to the National Alliance of Mental Illness, 18.1% of adults in the U.S., or over 42 million, experienced an anxiety disorder such as generalized anxiety, post-traumatic stress disorder, obsessive-compulsive disorder, or specific phobias. 6.9% of adults in the U.S., or roughly 16 million, had at least one major depressive episode. Approximately 1 in 25 adults in the U.S., nearly 10 million, or 4.2% of the population, experiences a serious mental illness in a given year that substantially interferes with or limits one or more major life activities, such as their ability to work productively. And unfortunately, less than half, only 41% of adults in the U.S. with a mental health condition, receive any mental health services to treat their condition. For most, a combination of stigma and real or perceived barriers to access are to blame for this serious problem that is impacting workplaces across the country. Mental illness is also costly. As you can see from these statistics, the social and economic impact cannot be ignored. Mental illness costs the U.S. $193.2 billion a year in lost earnings. Depression is now the leading cause of disability worldwide, and mood disorders like depression and bipolar disorder are the 3rd most common cause of hospitalization. At its worst, depression can lead to suicide. Suicide is currently the 10th leading cause of death in the U.S. and is now the 2nd leading cause of death for young adults. And because of the connection between the mind and the body, people with mental illness are also at higher risk for chronic medical conditions. While staggering in and of themselves, these statistics don't begin to tell the human story of the personal suffering that mental illness can cause. By definition, mental illness impacts more than one aspect of a person's life. That means that the symptoms of mental illness or emotional distress will often have a corresponding impact on a person's job performance and productivity in the workplace. This slide highlights just a few of the common ways that mental illness, when left unaddressed, can impact the employee and the workplace. Managers and supervisors in particular are in a unique position to notice the signs and symptoms of distress and to create an environment where it is safe for employees to seek the help they need. They can also help guide employees to the resources available, such as an employee assistance program. That's why employee and supervisor training is such an important component of building a psychologically healthy workplace. Many employees today struggle with work-life balance. The challenges of balancing work and home lives can take a toll on employees' mental health, well-being, and job satisfaction. According to a national poll conducted by the American Psychological Association, two-thirds of employees say work has a significant impact on their stress level, and 1 in 4 has called in sick or taken a mental health day as a result of job stress. And as we have already seen, employees' mental health issues also impact their employer's bottom line due to increased absenteeism, diminished productivity, employee turnover, and direct medical, legal, and insurance costs. Faced with increased costs and competition, employers are more concerned than ever before about attracting and retaining high-performing employees, improving morale, and increasing engagement. Reducing workplace stress plays a significant role as employers and organizations look to protect their most valuable asset, their employees. Some companies have responded to these business challenges by taking better care of their employees' mental health. These employers are creating workplaces that do more than just improve productivity. They build a strong organizational culture that supports the company's long-term strategy for success. In short, they're building a psychologically healthy workplace. According to the American Psychological Association, a psychologically healthy workplace fosters employee health and well-being while enhancing organizational performance and productivity. Psychologically healthy workplace practices can be grouped into 5 categories: employee involvement, work-life balance, employee growth and development, employee recognition, and health and safety. There is no one-size-fits-all approach to creating a psychologically healthy workplace. Each organization must identify their own unique challenges and then develop programs and policies to meet those needs. Communication also plays a key role and serves as a foundation for all 5 types of psychologically healthy workplace practices. Research has shown that employees feel more engaged when they see how their work directly contributes to the success of the organization. Efforts to increase employee involvement empower workers, involve them in decision-making, and give them increased job autonomy. Programs and policies that increase employee involvement can increase job satisfaction, employee morale, and commitment to the organization, as well as increase productivity, reduce turnover and absenteeism, and enhance the quality of products and services. Examples of efforts to involve employees in meaningful ways include developing self-managed work teams, establishing employee committees or task forces, creating continuous improvement teams, encouraging participative decision-making, such as during employee interviews, and implementing employee suggestion forums, such as a suggestion box or monthly meetings. Work-life balance is one of the greatest challenges many employees face today. Programs and policies that facilitate work-life balance acknowledge that employees have responsibilities and lives outside of work, and help individuals better manage these multiple demands. Conflict between work and other life responsibilities can diminish the quality of both work and home life for employees, which in turn can affect organizational outcomes such as productivity, absenteeism, and turnover. Efforts to help employees improve work-life balances can improve morale, increase job satisfaction, and strengthen employees' commitment to the organization. Programs and policies that can promote work-life balance include flexible work arrangements, such as flex time and telecommuting, assistance with childcare, such as on-site daycare or childcare reimbursement programs, elder care benefits for employees in the sandwich generation, resources to help employees manage personal financial issues like budgeting, debt management, and financial planning, extending benefits to family members and domestic partners, and flexible leave options beyond those legally required by the Family and Medical Leave Act. Organizations committed to building a psychologically healthy workplace take steps to help all employees reach their full potential. Opportunities for ongoing growth and development help employees expand their knowledge, skills, and abilities, and apply what they've learned to new situations. The opportunity to gain new skills and experiences can increase employee motivation and job satisfaction, and help workers more effectively manage job stress. This can translate into positive gains for the organization by enhancing organizational effectiveness and improving work quality, as well as by helping the organization attract and retain high-quality employees. Opportunities for employee growth and development include continuing education courses, tuition reimbursement, career development or counseling services, skills training provided in-house or through outside training centers, opportunities for promotion and internal career advancement, and coaching, mentoring, and leadership development programs. Everyone enjoys being recognized for a job well done. Employee recognition efforts reward employees and teams for their contributions to the organization. Recognition can take various forms. They can be formal or informal and don't need to be expensive. By simply acknowledging employee efforts and making them feel valued and appreciated, organizations can increase employee satisfaction, morale, and self-esteem. Additionally, the organization itself may benefit from greater employee engagement and productivity, lower turnover, and the ability to attract and retain high-quality employees. Ways of recognizing the employee contributions include fair monetary compensation, competitive benefits packages, acknowledgement of contributions and milestones, performance-based bonuses and pay increases, employee awards, and recognition ceremonies. No one can reach their full potential if they are continually unhealthy or feel unsafe. Health and safety initiatives maximize the physical and mental health of employees through the prevention, assessment, and treatment of potential health risks and problems, and by encouraging and supporting healthy lifestyle and behavior choices. Health and safety efforts include a wide variety of workplace practices that can help employees improve their physical and mental health, reduce health risks, and manage stress effectively. By investing in the health and safety of their employees, organizations may benefit from greater productivity and reductions in healthcare costs, absenteeism, and accident and injury rates. Efforts to address health and safety issues in the workplace include training and safeguards that address workplace safety and security issues, efforts to help employees develop a healthy lifestyle, such as stress management coaching, weight loss, and smoking cessation programs, adequate health insurance, including coverage for mental health and substance abuse issues, annual health screenings, access to health, fitness, and recreation facilities, and offering an employee assistance program to help employees address common issues like job stress, family and relationship problems, as well as mental health issues like depression, anxiety, and alcohol and substance abuse. Finally, to build a psychologically healthy workplace, employers and organizations must also take steps to reduce the stigma of mental illness in the workplace. By acknowledging that mental illness is real, common, and treatable, and encouraging employees to take care of themselves as well as each other, organizations can help ensure that employees who may be suffering are never afraid to reach out for the help they need. Employers can take the following steps to help create a stigma-free workplace. Educate employees about the signs and symptoms of mental health disorders. Encourage employees to talk about stress, workload, family commitments, and other issues. Communicate that mental illnesses are real, common, and treatable. Discourage stigmatizing language and hurtful labels. Invest in mental health benefits for all employees. And help employees transition back to work after a personal leave of absence. Participating in an annual mental health awareness campaign, such as 1 in 4, can be a great place for many organizations to start. However, it is also important to ensure that the one benefit specifically designed to address employee mental health, the Employee Assistance Program, is fully integrated into the organization's overall population health management strategy. By offering employees free and confidential resources to address a wide variety of personal and work-related issues, as well as offering organizations expert consultation and training, EAPs are still the #1 resource for employers who are committed to building a psychologically healthy workplace. For more information on building a psychologically healthy workplace, visit www.apaexcellence.org or contact your Employee Assistance Program. Curlink Healthcare's annual 1 in 4 anti-stigma campaign kicks off on January 4th. The 1 in 4 initiative focuses on normalizing the need for behavioral health resources and removing barriers for those who want to access care. By opening up the conversation regarding these significant and treatable issues, Curlink hopes to raise more awareness of mental health concerns. The campaign runs through January 31st. We have created a variety of tools and resources to support this campaign, all of which are housed on our web platform at www.oneinfor.info. This informative website includes educational videos, data-driven infographics, a self-assessment tool, and a wealth of tip sheets in English and Spanish to help raise awareness of mental health concerns. The site also includes a robust resource center that makes it easier to take the steps to educate and respond to mental health concerns. Here are ways you can support this campaign. Visit www.oneinfor.info to become familiar with this resource. Add www.oneinfor.info as a resource on your company's intranet. Display 1 in 4 posters in high traffic areas for all employees to see. Wear a 1 in 4 wristband with pride. And join the conversation on Twitter at 1in4info, hashtag replace stigma with support. Thank you for your interest and support in the 1 in 4 anti-stigma campaign. Together, we can change the way the world views mental health.